Hello everyone, my name is Lynsie McCowan, and today we're actually going to be doing what is called myofascial release, okay? And we're going to be focusing on the neck, shoulders, upper back, and chest region, the area of the body that holds a lot of chronic stress, which can have an impact on our posture and also our ability to move the head and neck with any sense of freedom and to be, have our movement be efficient. So what we're going to need today for this practice is a block, perhaps, or a blanket, or both. So, oops. And also you're going to need 2 tennis balls or either 2 lacrosse balls. Now, these are called myofascial release balls, and you can, order them online, but they're essentially lacrosse balls. And I prefer these over the tennis balls because over time, the tennis balls will start to lose their firmness, okay? And we really it's better if, you might dispute this while we're actually in it, but it's better to have the firmness of the lacrosse balls or the myofascial balls. Okay, so I'm going to set the tennis balls aside because I'm not going to use those. So what we're going to do is let's start on our back. And the reason that, before I come on to my back, let me just tell you this. The reason that this is so important is because, yes, the muscles get tight, but the fascia is this connective tissue that weaves through all the connective tissues of the body, all the muscles of the body. And so when the fascia gets tight, it's going to restrict the muscular movement. So we need to actually address the tightness, the constriction in the fascia in order for the muscles to actually be able to have more pliability, more flexibility, more movement, okay, so that they're more efficient. Okay, so what we're going to do here is we're actually going to start on our backs, but we're going to get first into the muscles between the shoulder blades, which are called your rhomboids, which is a stabilizing muscle for the scapula, which are your shoulder blades. And so you're going to take the balls and you're going to bring them together with a little bit of space between them because that little space is where your spine is going to go. And the balls are actually going to go between the scapula, the shoulder blades, okay? So, and I would suggest if you have neck tension to have a blanket to support your neck for this one. So you're gonna have to kind of eyeball this. You're gonna take the balls about 1 inch apart from one another. And then we're gonna come down onto our backs and try to land right on top of the balls where they're between the shoulder blades. And we'll see how this goes. There we go. Okay. And so if you're super tight here, you're going to notice this pretty quickly. If this is too intense for you, you can come back up, take the blanket, and put that back on top of the balls so it's a little softer. Okay. So you can hang out here, knees bent, and knock together and kind of just relax. I know it's easier said than done when you have these balls digging into your muscles, but another option here is to take the arms out into a T position, and then we're going to bring the arms across the chest. Okay. Ooh. And then we're going to move in this way, opening and closing the arms. And make sure that the balls are not on the bone. If they're on the bone, you'll know pretty immediately. You want them between the shoulder blades, a nice soft meaty bit. And then you're going to keep moving the arms across the body and open. Just using a little dynamic movement to help soften the tissues. And then decide, okay, where do you feel the most tenderness? Or with the arms wide or the arms across the body? Okay, and that's where you're going to hold. Okay, and it's important to keep a nice rhythm to the breath because we're trying to release tension, and I know that if it's tender, we tend to clench or pull back from it or hold our breath, but just soften into it. Take a deeper, fuller inhale, more complete exhale. Now the thing with doing this kind of release, this myofascial release, is we want to actually hold this. I'd say a minimum 2 minutes. If you can hold 5 minutes, that would be amazing. And I know we always feel like I don't have time, too rushed, got too many things to do. But the question really comes up, like, can you afford not to do it? You know, the chronic stress that is happening on our bodies is not just impairing our body to move efficiently, but it's also creating that stress is translating into our thoughts and our emotions. And these are a lot of our postural muscles that we'll be working with today as well. And we want to be able to have more freedom and ease in our bodies so that there can be more freedom and ease in our thoughts. You know, when our bodies hurt, then our emotions and our thoughts are reflective of that. It's hard to keep an elevated mood, to keep elevated thoughts when we're in chronic discomfort. Okay, so from here, the fun part is always coming out of this. Now to come out, we're simply just going to roll to one side. And briefly, there'll be a little bit more intensity on that one side. Woo. And then I'm just going to press myself up for a moment. You can actually just roll back onto your back and just take a moment to kind of notice. Well, here, I'll lay down with you, so there's no confusion. Let's lay back down and then just kind of notice, oh, that release between the shoulder blades and that softening, and notice how there might even be a little bit more opening in the chest. Okay. So for the next one, we're going to need the 2 myofascial balls or tennis balls and a block. Now this is why I was going to sit up, so I could actually show you the area that we're going to be working on. So if you want to sit up with me, you can sit up with me. So we're going to be working with this area, not just the upper traps, so it's going to feel like the upper traps, which is going to be a portion of that, but it's actually this nice meaty bit of muscle that runs from the top of the shoulder and up, just up to the neck. Okay, so take your hand like a little lobster claw and then grab right here and squeeze. You know when someone comes and rubs your shoulders, that part, yeah, that feels so good and like so tight there. Yeah, that's what we're gonna get into. Okay, and then take the other side and just kind of rub there so we know. Okay, so it's gonna be right there above what's called the spine of the scapula, so you can feel that bone of your scapula kind of protruding out. That's where we're going to place the balls, okay? So what it's going to look like is you're going to take it right there on both sides, but we're going to be laying down. So I'm going to move my blanket out of the way. Okay, coming back, taking the balls, put them right there, right above the spine of your scapula, that little ridge of bone. Now this might feel like a little strain on your neck at first, but we don't want the blanket, because what's going to happen is we're going to take the block, you're going to lift your hips, and then place your sacrum on the block. Okay, now this is a little bit too low for, there we go. So we're going to feel that dig in. Maybe I shouldn't say dig in, that doesn't sound so sweet, does it? But you can feel it pressing into those tissues that are chronically tight. And relax the jaw. Okay, so the arms could be by your side, or you could even bring them in goalie arms. When you take them out into goalie arms, it's a little bit more intense. There's more sensation. But you pick and choose what's going to be most supportive. Now I'm moving my head to face the camera, but it's better if you just kind of look towards the ceiling. And we're going to hang out here and breathe. And just allow the balls to press into those tissues. And then we just soften around the balls. So again, we want to hold this 2 minutes, up to 5. And quite frankly, if that's going to impair you from coming down and doing this, just do what you can. If you got 30 seconds, 30 seconds is better than nothing. But because these are areas that are chronically tight and tense, we really need to give ourselves the time to release this tension. If we're chronically tight for hours and hours and hours of our day, I think we can maybe just take 5 minutes, 10 minutes, maybe 15 minutes to try to nurture ourselves and release this tension. Okay, so let's go ahead and take the block out from underneath your hips. Remove the blocks or the balls from right underneath. I didn't mention that muscle is actually called your supraspinatus. I didn't really mention that because it's a big word that you don't really need to know. Just you just know that it's tense and that we need to release it. And then just take a pause here and kind of feel into the muscles and feel them soften. And maybe there's a little bit of warmth, which means that there's a little bit more blood flow coming into the tissues. And that blood flow will help with pliability and movement and efficiency of the muscles. Okay, so let's go ahead and roll to one side and gently press yourself up. Okay, so we're going to do one more myofascial release. And we're going to focus on the pectoralis minor. Now that's the smaller chest muscle that lies under the thick pectoralis major, the chest muscle that we're most familiar with. And the reason that we want to show the pec minor a little attention is because it's a stabilizing muscle. It's very small, but it gets really super tight and it's very difficult to stretch. So we really need to use the myofascial balls to get in there to help release that tension, because just the chest openers and the chest stretches don't really get into the pec minor. And the pec minor, because it's a deep stabilizing muscle, when it gets tight, it will pull the head of the arm bone forward. And so if we're slumping forward, what I said before with the arms forward when we're driving, or looking down when we're on our smartphones or at our computers, or just kind of slumping on the couch or whatnot, this muscle is getting tighter and tighter and tighter, and yet we can't really stretch it. So what we're gonna do is we're gonna open that up a little bit by taking the balls, and we'll find our collarbone, which is also called your clavicle. And just palpate that with your fingers, and then from the clavicle drop down about 2 or 3 inches, and that's where we're going to place either the tennis balls or the myofascial balls. So it's really about between the 3rd and 5th rib, but if you're just right underneath the collarbone, you'll be fine. So we're only going to need one, and what this is going to look like. And you may or may not want your blanket, but you can decide once we come onto our stomachs. So remember, find that spot right there. I'm going to start on my right side. Actually, I'm going to start on my left side. I'm going to turn this way. It'll be easier for you to see. So you're going to take the ball, palpate the collarbone, bring the ball down just underneath the collarbone. Place the ball there. Come onto your stomach. Take your arm out to the side. So you're going to bring it out directly in line with that collarbone. And then you're going to roll. Like, this might be enough. As soon as you come onto it, you might be like, okay, that's pretty tight. Or if that's okay, what you're going to do is you're going to start to roll onto your left side. Okay. Oh, that's nice and tender. And you decide. The right hand can just kind of relax next to your side. If you want, you can put a blanket underneath your head so you're not cranking on the neck. And you can just hang out and breathe, okay? Nice deep breath in and out. This muscle will also get really tight due to stress. So we take a deeper, fuller breath. We're actually helping with the pliability of that muscle. And if you hang out here for several breaths and you kind of feel the softening of the tissues and you think you can roll a little bit further onto your hip, you can do that. But if any point in time it feels like it's too much, then guess what? It's too much. And you come out. And if you need to, you can also put a blanket on top of the ball to make it a little softer, a little less intense. And if you feel your body clenching, or if your breath is uneven, then that is also a sign that it might be too much. And so you either get the extra padding, or you roll forward out of it a little bit more. And we'll just take about another 2-3 breaths, because remember, we want to be here about 2 or 5 minutes, and just for the purposes of this video, we're going to hold the postures just a little less, but you know that you, just to give you familiarity with it, and so that you can come back to this and hold it a little bit longer. Okay, so from here, just roll to your belly, gently press yourself up, and just come to center for a moment and just kind of notice how it feels right and left. And then you can even move the arms a little bit and see and notice that there might be a little bit more warmth or sensation, or already an ability to move the arm a little bit more freely. Okay, now let's do the other side. So right side, place it right underneath that collarbone, coming down onto your stomach, and you'll place the hand out to the side, and then you're going to roll to your right. Now, I'm not going to do this with you because I have the mic on and it's going to obstruct the sound, but take the ball right underneath collarbone, arm is directly out to the side, roll to your right hip, put a blanket underneath your head. If you need that extra support so the neck can be relaxed, we don't want to bring tension into the neck as we're trying to open up the chest. And thinking about those deep, smooth inhales, complete exhales. Just remembering that if you're taking conscious breaths, if you're shaping your breath consciously, you're immediately having a positive impact on your nervous system. Nice full inhale, complete exhale, creating a rhythm of breath that is very supportive and nurturing. And remembering that when we take those shorter breaths, it's usually a sign that there's some tension that's happening in our bodies or in our thoughts that are creating the tension in our breath. So by consciously shaping the breath, we immediately relax the tissues of the body, and then we also relax the mind, or we relax the mind, and because the mind relaxes and the body can relax. So this is positive in the feedback loop. Okay, we'll take a couple more breaths here. And of course, if you feel like you need to stay a little longer, you stay longer. And then simply rolling out of it, nice and gently, coming up to your seat. And just take a pause. Head is over the pelvis. And notice the right and left pec minor, chest. And then just also noticing that supraspinatus and that upper trap that we opened. And then also the muscle between the shoulder blades. We said that that was the rhomboids, but also right on top of the rhomboids are the middle trapezius. And just notice that freedom in the front of the body, the top of the shoulders, and between the shoulder blades. And then let's just bring the hands together, bow the head down slightly. As always, we take a moment of gratitude for this body. Body that allows us to have these unique experiences. And whatever those experiences are, we always want to label things good or bad. But just know that the body is just giving us clues or cues to what it needs. And if these muscles are tight or tense or causing pain in the body, then that's our cue to self-nurture, to take care of that part of our body so that we can move with more freedom, more joy, a little bit more effortless ease. Take a nice deep breath in. Open the mouth and exhale. And then when you're ready, lift the chin, lift the gaze, and come back. So if you have any questions, feel free to leave comments for me, and I'll be sure to answer any questions you have. Until then, keep practicing, keep evolving, and stay in touch. Many blessings.